Hello, everybody. Hi. We are on. All right. Hello, hello. We're so excited to see you. This is our first virtual event of 2024.
Yeah.
And we get Faith today. We get registered nurse Faith, and I am so excited. We love doing these for all of you, and especially today because we get to talk about Morpheus8, and it's all the rage. I mean, celebrity favorite, my favorite, employees of Revive's favorite. It's just one of those aesthetic treatments that has really taken over, and for good reason. So we are going to answer all of your questions today, and we will talk all about this treatment. We're going to let Faith get her expertise. A little bit about Revive, if you don't know us. We are the #1 provider of Morpheus8 in California. So that is pretty cool. Like we do a lot of these treatments, and we're one of the first med spas in really the nation to really take off with this. And we've hopefully proven that with our #1 provider award there. We're also the #2 provider in the nation. So of all 50 states, right, we're here. So we know what we're talking about. We're also one of the top 10 providers of Botox, Juvederm, Voluma, Volbella, Kybella, and Skin Medica and Latisse in the nation as well. So anytime that you come to see us, we really know what we're doing. And also the #1 provider of cool sculpting. So if you haven't watched our virtual events of cool sculpting, they're usually with myself and Michelle. Just be on the lookout. We'll have another one of those coming up. But today we're focusing all on Morpheus. All right, so Faith. All right, I know I've been doing a lot of the talking, but you'll get to hear Faith all the rest of this time. But Faith, you want to tell everybody, if they don't know you, or even if they do, a little bit about your background and just everything.
Yeah, so hi to everyone. I recognize some of the names on there, so that's exciting. I do care a lot about patient education and you guys feeling comfortable with any procedure that you're choosing to do. So with that, we've had the device for over a year now, so I've been working with it that whole time, and previously had worked with radiofrequency microneedling before that. I love it because it's so regenerative. I think that's the future of a lot of this stuff, focusing on ways that we can heal the skin and improve the skin through using our own body. I worked in general surgery before doing aesthetics, and so that was a really good, background as far as wound healing and stuff like that goes. And it's been really helpful in assessing the skin and doing good treatments with this device. So again, I just love it for how regenerative it is. And so I'm looking forward to kind of explaining that to you guys. It's very science-backed, and there's a lot of good reasons why it's a great treatment. So we'll get into all of that.
Absolutely. And let's give you a shout out. You'd often do about 10 plus Morpheus8 procedures a week.
It's very popular.
A week.
And especially, this time of year, it's not summertime quite yet. So we call it laser season, or this kind of a little bit more downtime. We're in the sun a little bit less. San Diego, we're lucky, we get a lot of sun year round, but it's a good time of year to get in these treatments as far as healing goes.
All right, so let's get into it. So what is Morpheus8? Can you just give us the broad overview?
A quick overview. So
Yes.
A lot of people have heard of microneedling, basic microneedling. So we're just damaging the skin mechanically and getting that wound healing effect. Morpheus is special because it's radiofrequency in addition to that microneedling. So when those microneedles are going into the skin, it's also emitting a certain amount of radiofrequency that we set via the machine based on your skin type, your goals, etc. So we can go a little bit deeper in the skin, given that heat profile gives us a little bit more depth to penetrate the skin and to get more collagen elastin stimulation to help, again, stimulate that wound healing response. In turn, we're getting new, healthier skin. We can use it face and body. We'll get into the differences of that and expectations there. But it's really popular because of the technology of it. Again, the radiofrequency giving us more depth to play with as far as actually remodeling the skin, giving you new, refreshed skin, and again, using your own body to do so.
Amazing. That's so concise and so perfect. All right. So yeah, tell us a little bit, you kind of said it, but how does it work really?
Right. So we want to revitalize collagen. Collagen is the protein. It's a building block of our skin, hair, teeth, nails. And so we start losing it. We start losing a couple different nutrients in the skin as we age. And so we always want to be, preventing the breakdown of it and promoting the production of more of it, or at least giving it what it needs to thrive. And so this RF energy heats the deep layers of the skin in a controlled way. So kind of controlled trauma response. That basically, when your skin thinks it's damaged, it's going to flood all those growth factors to that area to help revitalize and regenerate the skin. And that's when we start to see those outward effects. So we're starting from within and we see tissue regeneration from the outside.
I love that. So it's making your own body work for you.
Yeah.
So that is pretty cool. All right, so let's keep going here. So we're gonna show you a quick video, and then we'll go through like what you're looking at. So take a look, everyone, of an actual treatment on the face.
Yeah, so I always show patients what the device looks like, because sometimes, people are intimidated by the pain, understandably, but it looks kind of like a little stamp device. And I love the way that it's made because we can be efficient in the way we can get through a treatment. But what you're seeing is every time I stamp, those needles are deploying, they're emitting the radio frequency that I set on the machine based on, the different treatment areas, and there are a bunch of different parameters that we go off of to treat you safely. So when I do a face and neck, that takes me 45 minutes to an hour, after we've numbed you for an hour and 15 minutes with topical lidocaine.
Perfect. So yeah, that's a good point you brought up, is about the numbing, right? We get a lot of questions about that. Everyone's like, oh, what does it feel like? Is it painful? I mean, we use a very, very strong numbing cream for, and like you said, 75 minutes prior to this treatment. We also can offer a Pronox laughing gas to help alleviate any like discomfort. So you'll see in a few slides ahead of, somebody with like, it's a tube in their mouth that looks a little like scary, but it's really just, it just kind of relaxes you.
Yeah.
And it's, it helps with pain management. And again, I've had it done 3 times now. And I mean, with the numbing cream, the Pronox, it was very tolerable.
Yeah, we have the pain management dialed now because we've gone to conferences that were put on by the makers of this machine. We met with different surgeons that do different things to talk about numbing and pain management. And so we've got a really good system. I even do lidocaine injections, which is a really diluted form of lidocaine injected in specific areas around the jawline. I like to do that because it can be a little bit more sensitive there. So we tailor it completely to your pain management needs.
Perfect. And Jody just commented she just did yours and it wasn't that bad. The
Good.
numbing cream worked well. We'd love
Strong,
to hear
yeah.
that. Yes, it's very strong.
Yeah.
Like you'll be like, am I smiling? I can't feel.
Yeah.
So it works very well. That's really good to hear. And we can't wait to see your results, Jody. That's awesome. All right.
Great.
So with the Morpheus, like we said, you can do face, body, neck, chest. It's all over, right? So obviously we're going to need different tips and stuff. Can you kind of go just our little portfolio of tips we have?
Yeah, then those all might look the same at a topical level, but I'll tell you the difference. So Morpheus8, the basic one, we're using 24 pins, which is our standard tip. So most treatments, we're going to be doing 24 little microneedles. That's that first one. That second one is for surfacing. So this is going to be an add-on to the procedure that I love for things like lines around the mouth, more superficial skin laxity issues, sometimes even the brow, kind of some creepy skin over the brow, which sometimes can make people feel dropped in there. Really love it for under the eyes. That's such a thin area of skin. So that resurfacing tip, it's actually not deploying any needles. It's just emitting radio frequency to help with skin tightening and skin regeneration in that area. It's also nice because I'm not worried as much about bruising the under eye region with the resurfacing tip. Prime, another really good one, that third one to use for smaller areas around the mouth, around the eyes. So see how it's a little bit smaller. There's 12 needles instead of 24. So just a little bit smaller, a lot more easy to work around, and we get those extra passes for extra good regeneration in some more sensitive areas. The body tip is going to be a little more heavy duty. The body is where we're going to go more deep in the tissue, depending on, amount of tissue that we have to work with. For example, in the body, I like to do a lot of abdominal skin tightening. So whether it be postpartum, post-surgery, there's so many different reasons, but it's really great for that. So the body tip is where that would come in handy, because we can go a little bit deeper in the skin to remodel collagen a little bit deeper and get through a little bit more tissue.
Perfect. And this next slide here, it's going to show you kind of like exactly what Faith just said, but you can actually read it now with like the depth and all of that. So perfect. I like at the bottom too, it talks about how many sessions, because that's a question people always ask, how many sessions am I going to need to see any result? So if you kind of want to talk about the areas and like the session, how many?
Yeah, so face and neck, a lot of times we're doing 3 treatments, and we're doing one every 4 weeks, so once a month-ish. The reason why it's so good to do additional treatments is because, of course, when we're stimulating your body, more the merrier really as far as that goes. But really it takes 60 to 90 days after your last treatment to really start to see those effects, which is the best part about it, because you're going to continue to get benefits after even your last treatment. For the body, for something like scarring, I'll show you guys some pictures later, we might need more sessions, more like 5 or 6, because we're really working on a specific thing like scarring and remodeling some irregular tissue versus just enhancing, normal healthy tissue. So 3 to 6, 3 to 5 is kind of the range depending on your specific concern.
Perfect. And I'm really happy you brought that up because everyone's different, right? And so at Revive, it doesn't matter the treatment that we're doing, it's customizable to you. So you're going to work with your provider, and they're the most knowledgeable, obviously, if you can't figure that out yet. And they're going to really help you and choose the best treatments and the treatment plan for you. So it's very one-on-one. I mean, they care, like you want people to have the best results possible. So
yeah. And I see a good question about the tips. So good question. So let's say we're doing a face and neck treatment. I would use the standard pin, that 24 pin we talked about for face and neck. The add-ons would be resurfacing or prime tip. Those are 2 separate add-ons that we can do. Let's say you have a main concern of black skin around the eyes, then we might want to add on the resurfacing tip if it's safe for your skin type. So those kind of range as far as adding on, but the consultants do a really good job of kind of working that in the packaging. Same thing with prime tip, you're really getting a lot more extra passes if we're adding on a prime tip, because we're going to go through everything with the standard tip and then back through those sensitive areas with the prime tip.
Perfect. I love that. And a good question they're asking, do you use all the tips throughout the treatment? So Taylor, I mean, just from my experience, like if you're doing face, you're not going to use the body tip on the face, right? So it's
and that's something we also want to talk about, because we don't want you to lose any volume in your face, right? We want to keep that volume to help prevent premature aging and all these other things. That's why people do so many other things. We actually want you to gain volume in your face. And so we wouldn't use something like the body piece in the face. That would be for thicker tissue, like the abdomen, the arms, the legs.
Perfect. Yes. And that's like kind of what Kim Kardashian loves. She does it on her body. There's videos all around, the internet of her doing that. And that's really how she gets that skin tightening, right? And like the resurfacing there. So, that's what the body's for, the body tip. All right. So let's talk about the benefits. I know we kind of briefly went over it, but this is like, why are we going to want to do the Morpheus? What are we going to get from it?
Yeah. So we talked about why it increases collagen production, that heat, as well as that wound response that we're generating. With that, we're going to get improved skin laxity. Radiofrequency, because it has that heat component to it, is going to help with a little bit of that tissue constriction and skin tightening, therefore, on the outside. Improving the appearance of fine lines and wrinkles, because when we do get that skin healing over time, that fresh skin is going to come back a little bit stronger and more resilient. And I also see that through every time someone comes in for their next treatment, their skin handles the procedure that much better, because your skin has grown back stronger and healthier. Helps to sculpt the jawline. That is one that I think is really helpful when patients have specific concern, let's say, of jowling. So that is, a result of fat pads migrating downwards over time. So we get a little bit of pulling here. So we can really do some extra passes in the jawline. That is the one area in the face where we can talk about possibly doing deeper settings. If it's deeper tissue here, we wouldn't want to do that here, but lower in the jawline, we can talk about that. That's where this gets really customizable and really specific to your anatomy, which is just like everything we want to take into consideration. Acne scarring, really good indication for this. So anytime you have someone, we have different means of addressing pigmentation, like broadband light therapy and different lasers. But when we really have textural concerns, Morpheus is hands down the best treatment for that, because it's really going to help remodel some of that tissue that has pitting and scarring from whatever trauma happened or hyperpigmentation, post something inflammatory like acne and something like that. Stretch marks also, usually around the abdomen and the leg area, we get, improvement in that because of the wound healing response. So lots of different indications, and they're really customizable based on what you're going for.
There's really like every benefit to this.
Yeah,
there's so many. We have to throw this up just because there's, like we always say, this is a celebrity favorite, and again, for good reason. But so obviously, I'm sure you've all seen Kim Kardashian's name out there. We've got Bella Thorne, January Jones. Like, this is a tried and true treatment that people are really, really gravitating towards because, it works, and it's definitely worth the hype and figuring it out if it's going to be right for you as well and your concerns. Perfect. We have some before and afters, but first I want to, we had a good question from Renee here. So like, it's very common that people will get the misconception that Morpheus is a laser.
Right.
And so I just want you to reiterate exactly like what it is and how it differs from like the Halo face treatment, which is a laser, or our at any other lasers?
Yeah, good question. And sometimes people like their face is red after both. So what's the difference? So lasers are what they sound like, certain laser therapies with different wavelengths for different concerns. So Halo is going to be more of a resurfacing treatment at different layers of the skin. And that's using specific, again, wavelength of laser. Morpheus radiofrequency is not considered laser. It's a different type of energy, radiofrequency. And so what we're doing is going deeper into the skin, which is why people also love it for the downtime. Halo, where you might be having downtime for 2 weeks, let's say, Morpheus is doing work a little bit deeper in the tissue. So sometimes people don't even bleed so much on the surface because what we're doing is a lot deeper in the layers of the skin, which is why it is so great, because we're doing that work internally and that shows externally after some time.
Perfect. All right, so let's check out some before and afters, because these are, this is an actual Revive client, and I have to give a shout out because this is actually one of her clients that she has lovingly shared with us. But I mean, wow. Okay, let's talk about this.
Yeah, so she had great results. We did 3 sessions. We did PRP add-on. We'll talk about PRP exosomes. These are just ways to heal better and help boost results after the procedure. She got really great skin texture improvement. And I noticed that specifically like around her mouth, you can see there. That is she's a great example and candidate for that resurfacing tip that we talked about, because those kind of little fine lines, that resurfacing tip does wonders on. And so she tolerated this really well. I remember she didn't have too much of an issue with pain. So we were able to do some high energies, which is safe for her skin type, do the face and neck. And then I love how she has actually more kind of volume going on in the mid face, because that helped the lower face as well.
It's amazing.
Yeah.
Wow.
Her skin just looks so healthy.
I know.
Yeah.
That took 10 years
Yeah.
off. That's crazy.
Yeah.
Perfect. So here's another one.
Yeah, this is one of Nurse Haley's. So her skin looks great. It's glowy. I feel like that's the biggest thing people notice even just after one, because when your skin, grows back and grows back healthier, it shows. And so you can see that here. And the under eyes, I love it for under eyes. I always notice just subtly, but it really helps there, as well as kind of some of those horizontal necklines as well.
It's amazing. And yeah, again, even like here and like the nasolabial folds, it's just plumps it up. Like you said, it gives that structure for more lift.
This is a great one, texture example. This result, I would say, like from one treatment, I noticed really big improvements like this in texture. This one's after 3. But I love, around the eyes, forehead, around the mouth. And someone asked about pore size. So anytime we're doing microneedling or something regenerative like this, some people will note reductions in pore size through that healing process. And so the external effects of that is an improvement in texture. You can see in her necklines too, that really helped. The neck is such thin tissue that it's, sometimes harder to treat. We get less nutrients kind of delivered to that area and to that part of the skin. So Morpheus is a really good way to address necklines.
Definitely. Even the jawline, just like you said, tightening up there. Perfect. All right. So this one, remember we were talking a little bit about scarring. So yeah.
So this is a patient who had a surgical intervention done on her underarms. I think surgery was 2 or 3 years ago. So that scar just had a hard time lightening up. There's plenty of research and data on why radiofrequency microneedling specifically after a surgical procedure really enhances the wound healing. It makes a lot of sense because we're just giving it a little extra boost. So we did get some improvement in that texturally, and then I actually did a little bit of laser broadband light therapy on the remaining pigment. So that's a really good combo for addressing scarring. And she was so happy because obviously you do a surgery for one reason, and then if you're left with, intense scarring, that can be a different type of insecurity or something like that. So this was a really good option for her. Someone asked about loose skin following Ozempic treatments, and that is a thing. And Morpheus can help with that too, because that is a major, any type of rapid weight loss, whether it be illness or medication. Morpheus is a great way to help address skin laxity.
Love that. Oh, this is our favorite scar.
Yeah.
I love looking at this.
Yeah, this is a great one. So we did 5 sessions on her, and we did them 6 weeks apart. So for the body, we can spread that out a little bit longer. Great result as far as that scarring specifically. It was a little bit newer of a scar. We also want to get clearance from a surgeon, make sure that we're not doing it too soon. We don't want to reopen or have any issues with that. But this was an old enough, more mature scar where this treatment worked really well. She also got some skin laxity improvement around that area. So yeah, she had a great result.
That's crazy. That one just so cool.
Yeah.
Oh, under eyes. Okay, this is like amazing because like you said before, it's such a tender, very fragile area, but wow.
Yeah, so there's, again, yeah, like you said, it's a fragile area treating the under eyes. It's fragile tissue. We don't want your eyes to look puffy. I like PRP for the under eyes. There's all these different indications, but as far as the dressing, like the actual skin itself, this is hands down the best way to do so. Normal microneedling would help, like that picture on the right, would help a little bit, but without the radiofrequency, wouldn't get as dramatic of that skin tightening that she got. And so that's a really great example of under eyes.
Oh, that's so good.
Yeah, it's a good one.
I know. That's always everybody's problem area, I mean, oh, this one too. Wow.
Yeah, so that herniated tissue, that means just kind of like the outpouching there that you see on the eyes, that's common, and that's would be a big no-no for something like filler because we don't want to add volume or add puffiness to the area. So that's where Morpheus comes in because it's a different type of, remodeling. This is a really specific case from the Morpheus manufacturer, so we'd be doing some really aggressive settings to achieve that kind of result. But like, again, it's so customizable that I've had patient cases where we do have incidences of that. We can have some improvement with some of that tissue that outpouches there.
So good.
Yeah. Yeah, neck laxity too. It's fantastic.
Definitely. I mean, that's just such an improvement.
Arms, yeah, I'm treating a lot more arms recently. Skin laxity is, a big concern in the underarm area, and so that's a great example of an improvement of that.
Yeah, just the collagen too.
Yeah,
it's wild. Ooh, okay, so exosomes. I know we kind of teased them in the beginning and with like PRP exosomes. So Faith is also an expert on these. Yeah, can you tell people a little bit about exosomes and why we're gonna add them on to a treatment if that's worth it?
Yeah, and then I saw too, there's just one quick question. Someone asked about fillers and Morpheus. So and yes, it would help in dentin type scarring. So we can take a look at that, see kind of your scarring history and how it could help you. But just really briefly, then I'll go over exosomes. We want you to wait. We'll talk about fillers, but we don't want to do Morpheus too quick after injectables like that. And so we would need to do more research. How long ago did you have that? And talk about how long we need to wait, at least over 6 to 8 weeks, if not more. So we will look into your specific case and see what your history is with injectables to make sure it's safe to do Morpheus.
Yes, and once again, why you want to work with your provider one-on-one, because we want you to have the best options and treatments, right? And the best outcomes. So very important to work and like space it out, because everything is great when you kind of add it on, do a little here, you're going to get the best results.
And I think when we're doing something like Morpheus, it's good to do this first and do your sessions, then we can reassess, because this is going to enhance your skin quality so much. You might get improvements that you didn't even realize you would. Then we say, okay, we've done our 3 sessions. Let's reassess your skin. What kind of needs do you have? Do you still have volume loss in here? Maybe we could talk about PRP. So there's a lot of different reasons, but doing this first is a good way to go. Okay. So exosomes, these are fantastic. They're a way to decrease downtime and speed up and increase actually the results. Exosomes are basically their excretions from stem cells. So where we're not doing stem cell therapy, they're excretions from stem cells that tell our cells to regenerate and to repair. And so if you've heard of PRP, which is platelet-rich plasma, this means we draw your own blood, we put it in a machine, we get out your growth factors from your plasma, and we use those on your face. These are 3 times the potency of PRP. So they're a way to standardize PRP. We don't have to do a blood draw. And they're human derived. So they work great, obviously, with our own skin. Again, enhance the wound healing because they're so anti-inflammatory. So we'll show you some pictures in a second about why they decrease the downtime so much. And then they also have the capacity to stimulate collagen and elastin because they are derived growth factors.
Love it. Oh, here you go.
Yeah, that's a great one. So this is a patient I treated recently, and this was immediately after you see that picture, 30 minutes after and 24 hours later. So as far as downtime goes, you could be back to work the next day. We want you to leave the exosomes on for 24 hours. So that's something to consider. No sunscreen, no makeup for 24 hours when those are on your skin, because we want them to absorb and do their thing, heal the skin really well for the first day. So you can see how much they helped and how much they brought down her inflammation.
That's insane. 24 hours. That's like,
Yeah.
I mean, that's always a big question people ask, right? Nobody has time for downtime. That's like our slogan. We're like, we want to get back. We have stuff to do. We're busy.
Yeah.
So, I mean, that's another great thing about this treatment is that it's such minimal downtime. And then if you add on those exosomes, I mean, you saw 24 hours looks like nothing.
Yeah, it
Nothing even
makes a big
happened.
difference. So a really great add-on opportunity. Pre and post care, the big stuff really, we don't want to use any harsh chemicals on your skin after this. It's going to be obviously a little bit more vulnerable and sensitive. So things like retinol, you want to hold off for a week after and before the procedure. Really be good about sun exposure. It's just going to make you that much more sensitive. We always want you to be good about sun exposure. No exercise for 48 hours. That's a big one too, because as the skin's healing, we don't want to introduce any sweat or any bacteria or anything that can cause any infection. I've never seen it, but we always want to be safe. And then proper skincare. So we can talk about, we love our Alastin medical grade brand because we know the ingredients, we know that it's not going to irritate your skin, and we know that it's made for post procedure.
So perfect. All right, everyone. Self-care is important.
Thank you,
Thank
guys.
you, Patty. Thanks, everyone. Have a great rest of your day. See you soon.